Friends, private health service may seem more efficient, but they are also more expensive. If people are getting better services at private hospitals, they are also paying for it. Government hospitals are no doubt cheaper, but they face a host of problems like shortage of doctors, medicines, overcrowding, etc. Unfortunately, it is highly doubtful whether the poorer classes can have access to private healthcare facilities given their exorbitant rates.
Question 1. What is private healthcare services? Answer. Healthcare services that are provided by private, that is non-governmental, medical institutions, independent doctors, clinics and private companies are called private healthcare services. This includes hospitals and nursing homes that are privately owned, private doctors' clinics, laboratories that do tests and offer special facilities such as X-ray, ultrasound, etc., and shops from where we buy medicines. Private healthcare facilities are not owned or controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. Compared to public healthcare, the facilities, comfort and convenience offered by private healthcare is much greater. Question 2. What are the main differences between public and private healthcare services? Answer. The main differences between public and private healthcare services are as follows. Public healthcare services are owned and controlled by the government, whereas private healthcare services are privately owned by individuals and companies. Public healthcare services provides quality healthcare services either free or at a low cost, so that even the poor can seek treatment, whereas private healthcare is much more expensive. Public healthcare cover both rural and urban areas equally, but private healthcare is mainly concentrated in urban areas. As compared to public healthcare, the facilities, convenience and comfort provided through private healthcare is much greater. Question 3. In India, we face a situation where private services are increasing, but public services are not. How has this impacted the healthcare scenario in the country? Answer. Since private healthcare services have increased at a much faster rate as compared to public healthcare services in India, there is a visible change in the healthcare situation of the country. What is mainly available to people in current times is private services. As these services are run for profit, the cost of these services is rather high. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. Medicines have become very expensive and many people cannot afford them or have to borrow money when there is an illness in the family. In fact, barely 20% of the population can afford all the medicines that they require during an illness. Moreover, since most of the private hospitals are concentrated in urban areas, people from rural areas have to travel long distances and face a lot of inconvenience to see a qualified doctor. Question 4. Mention some of the reasons which prevent people from getting proper medical treatment. Answer. Some of the reasons which prevent people from getting proper medical treatment are as follows. The lack of money is the main reason that prevents people from getting proper medical treatment. Many tribal areas and remote villages have very few health centers and they do not run properly, which prevents the people from receiving proper medical treatment. In many cases, women's health concerns are considered to be less important than the health of men in the family and are neglected. The great distances that people have to cover, especially in villages, to receive medical attention is another reason which prevents people from receiving prompt medical treatment. Question 5. Mention some of the disadvantages of private healthcare services. Answer. Some of the disadvantages of private healthcare are mentioned below. All these services are run for profit and cost of these services is quite high. Many people cannot afford them or have to borrow money when there is an illness in the family. In order to earn more money, these private services encourage practices that are incorrect. At times, cheaper methods, though available, are not used. For example, it is common to find doctors prescribing unnecessary medicines, injections, or saline bottles when tablets or simple medicines can suffice. Since most private healthcare services are concentrated in urban areas, the rural population is neglected. Question 6. What does private healthcare service include? Answer. Private healthcare service includes the following. 1. Hospitals and nursing homes that are privately owned by individuals and companies. 2. Laboratories that do tests in special facilities such as X-ray, ultrasound, etc. 3. Doctors who run their own private clinics and who provide specialized services. 4. Registered medical practitioners, RMPs, who provide medical assistance in rural areas. 5. Medical shops to buy medicines. Question 7. Under which circumstances private hospitals are preferable to public hospitals? Answer. Mentioned below are few circumstances in which private hospitals are preferred to public hospitals. 1. When we want prompt treatment and are not willing to spend time waiting in long queues for receiving medical attention. 2. When we want individual care and specialized treatment. 3. When we are willing to spend extra money to enjoy the luxury of comfortable rooms, privacies, and other luxuries. 4. When we are not concerned about expenses. Question 8. In order to earn more money, private services encourage practices that are incorrect. What kind of practices are referred to here? Answer. In order to earn more money, private healthcare services at times encourage practices that are incorrect. Even when cheaper methods of treatment are available, they are not used and expensive treatments are prescribed. For example, it is common to find doctors prescribing unnecessary medicines, injections, or saline bottles when tablets or simple medicines can suffice. Moreover, as these services are run for profit, the cost of these services is rather high. Question 9. For those who are poor, every illness in the family is a cause of great anxiety and distress. Elaborate the statement. Answer. As healthcare services are becoming more and more expensive, many people can't afford them or have to borrow money when there is an illness in the family. In fact, barely 20% of the population can afford all the medicines that they require during a post-operative room in a leading illness. It was reported in a study that 40% of people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expenses. The situation is worse for the poor because it tends to happen again and again. Those who are poor are in the first place undernourished. These families are not eating as much as they should. They are not provided basic necessities like drinking water, adequate housing, clean surroundings, etc., and therefore are more likely to fall ill. The expenses on illnesses make the situation even worse.